Welcome to Black Health Matters. I'm your host, Darryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
They're making with dementia research. And Alzheimer's is thought to be about almost close to 80% of the dementias that affect us, although there are many other forms of dementia, as we all know. But the commonest is Alzheimer's. And there have been some findings in the last year that are suggestive that we're making progress. We aren't there yet, but we're getting closer. And this article talks about the 7 advances that they've made in dementia over the last year or so. And in many ways, not as dramatic as you would like them to be, but they're helpful nonetheless. The first one is that they have a new blood test that tests for beta amyloid, and that is associated with Alzheimer's in most cases. And so this new test, along with everything else, will help you make an earlier diagnosis of Alzheimer's dementia. The only issue that still remains is that we don't really have a good way of treating Alzheimer's once we diagnose it. But we'll talk about some of the other advances that have come along. But at least there is now a blood test that identifies the dementia that's associated with Alzheimer's. The second is that they have identified better ways of treating Alzheimer's. In the past, the biggest problem was that the treatment that they had for Alzheimer's was difficult to get across the brain barrier. And so most of the treatments would not get actually to the brain itself. And so that was a concern. But they now have identified 2 new medications that allow the drug to actually cross the blood-brain barrier. And this means that in the future, the medications that we do have that slow the progression of Alzheimer's may in fact be more helpful. So it's still too early to say how helpful this will be, but this is a step forward because in the past we didn't have medications that would cross the blood-brain barrier. And so Roche has now come up with a piggybacking treatment that allows us to happen, but it's early in the process, and studies, class 3 studies have not yet been done to take it any further than to say that it's a very suggestive treatment that allows the medication to pass through the blood-brain barrier and knock out the amyloid plaques that are thought to be causing the Alzheimer's dementia. And the third thing is that there is a now gene therapy that has helped get treatment for what was formerly thought to be an untreatable disease, was Huntington's dementia, which formerly has been totally untreatable. But with this gene therapy, and the ability of having the therapy to cross the blood-brain barrier, there's the expectation that this gene therapy will be actually able to reach the brain and benefit this Alzheimer's dementia and maybe other dementias. Huntington's uh, dementia was thought to be the most untreatable and incurable that there was, and to have some advances in this disease is a hopeful sign. The fourth is we know that there's a gene, the APOE4 gene, that is associated with Alzheimer's, and uh, we know that anti-inflammatory drugs like the GLP-1s and others uh, may be helpful in cutting down the inflammation that goes along with the Alzheimer's uh, Alzheimer's dementia. That there's so many. There are other dementias, as we know, but inflammation is part and parcel of most of the dementias. So anti-inflammatories may be helpful, but we're learning more about how to use the anti-inflammatory drugs like GLP-1s and others. Uh, and of course, there are other neurodegenerative diseases like Parkinson's that this may be of helpful for as well. Then of late, we've talked about the uh, vaccines and how we talked about the RSV vaccine and the shingles vaccine and how they have decreased the percentage of people who get Alzheimer's and dementia. And so these vaccines, the reduction by RSV and by zoster, the shingles vaccine, are hopeful signs that we're making some progress. And then the sixth one is, as we talked about, the importance of lifestyle interventions. We talk almost every week about the importance of diet and exercise and meditation, etc. And we talk about the ways in which you can keep your brain active and be socially active as well. Whether you have the APOE4 gene or adhering to the vegetables and decreasing the meat in the diet, all of those things, the exercise, meditation, all of those things are ways in which modifying your lifestyle can decrease the likelihood of getting Alzheimer's. And then most recently, association of lithium, which is a drug that is relatively cheap, that has been in the armamentarium for quite a while, is now being identified as a therapy that may be effective against Alzheimer's as well. So these are the seven encouraging developments that the author talks about that give us some hope that uh, as we move forward, that we're going to be better able to diagnose and treat uh, uh, Alzheimer's dementia. We'll open the floor for any comments or questions about what we've talked about with the uh, advances in the management of dementias. No comments or questions about it? We still know that it's more common in people of color and women.
It's excellent information, Dr. Callender.
What's
So
that?
many of our, it's excellent information. So many of our families, so many of us are touched by one form or the other of dementia. And any information is helpful. It widens our understanding and maybe gives us clues, as to how to predict things or to learn to accept things. But knowing that there are tests and treatments too. And I find the information on the vaccines surprising and good to know, the RSV and Zostrix vaccines, that they may slow down the onset of dementia. That's excellent. Side benefits, right?
Thank you for
Thank
your
you.
comment. Yeah. Any other comments about the dementias? If not, the second uh, the second article is about how you can slow down the aging process of your brain. Uh, we've we've talked many times about what you can do to keep your brain young, and this article talks about the 5 steps the author identifies. Some of them are uh, surprising, some aren't. The first one that he talks about is the importance of getting 7 hours of sleep every night. Well, uh, some people only get 5 or 6, but the recommendation is for 7 hours of sleep. And they feel that that allows the brain to recover from all of the destructive elements that occur during the day. So that 7 hours of sleep is recommended. That's the first thing that he identifies as getting enough sleep. 7 to 8 hours of sleep is a recommendation because just about all of the studies identify this as the most important. And if for some reason you don't get the full 7 or 8 hours, then you might take some naps during the day to help with that, although there's a number of articles that may disagree. But this author suggests that if you can't get enough sleep, if you don't get the full 7 to 8 hours, you might try napping to make up for it. Then the second thing that they recommend, which is uh, you keep you keep reading about articles about handling stress, and of course, our complexion is stressful enough, and so meditation, of course, and the type of meditation that you want to use, it depends upon you and your preferences. But meditation is a strong way of overcoming stress. Uh, we also know that exercise and of course the anti-inflammatory diets that are vegetable uh, rich and fruit rich and meatless, generally speaking. So that's handling stress is probably number two. And then three is being socially active, interacting with others. Uh, this is it's clear that social isolation is uh, gives you a higher risk of neurodegenerative diseases. It doesn't say that social interaction will eliminate the possibility, but it decreases the likelihood of some of these neurodegenerative diseases. So being socially active is what he considers as the third important interaction that would keep your brain from aging. And then fourth, he mentions exercise, and we talk about that also every Thursday. Um, Getting a minimum of 150 minutes a week, uh, uh, every week minimum, along with, of course, uh, resistant exercises is probably a very important way to uh, de increase your brain activity, as well as a good way to decrease stress as well. And then the fifth thing is to keep your brain active, learn new things. You remember John Tatum was always talking about checkers and chess and uh, those things that keep your brain active, and of course, music and other art and those kinds of things are very important as well. And then finally, the last thing he talks about is the importance of diet diet alone, just uh, doing away with the inflammatory things that we put in our mouths, the emphasizing the importance of fruits and vegetables and uh, meatless diets are something that he he identifies last, but still important. So those are the six items that they recommend to keep our aging brains young. Uh, any comments on these six items that they talk about in terms of how to keep your brain young? Yes, Carol.
Um, I agree with everything except for I'm not quite sure about the sleep because if you go to nursing homes or etc., you see them sleeping all the time. And as you get older, sometimes, you might just nod off, whether it's in church or wherever. But at the older generation, it just seems like they just nod off all the time. So is that 8 hours or 7 hours of continuous sleep? And I know you mentioned napping, but there's some such thing as napping too much. But I do know babies, they sleep a lot. So what's the
Well,
explanation for sleeping?
well, it's clear that there's many studies that identify that the optimal sleep is 7 to 8 hours. But your point is well taken that one of the signs of aging is that you spend much more time sleeping, and you do have people who nap a lot, but the role model is 7 to 8 hours of sleep. And there are studies that have different commentations about the importance of napping or the importance of not napping. So, yes, the sleep they're talking about is 7 hours of continuous sleep. And I've seen so many different articles on napping. You can see, I've seen articles that say napping is good. I've seen articles that say napping is not good. So it's kind of hard to answer that question. Darryl?
Can you hear me now?
Yes.
Okay, good. Yeah, REM sleep, that's rapid eye movement sleep. And that usually happens about 90 minutes after you fall asleep. And that's characterized by vivid dreaming, increased heart rate. That that's the restful type of sleep that can, after you get your 7 to 8 hours, if you have those episodes of REM sleep, that's when you feel rested, where you don't have to uh, nod off, take naps through the day. So, getting that 7 to 8 hours sleep in the REM sleep is the key for making you feel young again as far as sleep goes. The feeling old, that's where you're sleepy all the time because you can't get restful sleep.
And they talk about the fact that you know that it's good when you wake up and you feel refreshed. Because after you sleep and you don't feel refreshed, there's a feeling that you really haven't had the REM sleep that is recommended.
Yeah.
Any other
One
comments?
other comment uh, for older people, it's that nocturia, waking up to pee. in the middle of the night, getting up 2 or 3 times, that prevents you from having the restful sleep. So if you can get a handle on your nocturia, you're much more likely to get the restful sleep.
And what is nocturia for those who don't know?
Getting up to pee several times a night, 2 or 3 times a night.
Right.
So the urea part is urinating at night.
Yeah. Thank you. Any other comments about that young brain syndrome? Janice?
I don't know about young brain syndrome. My sleeping pattern has changed over the past several years. And it was a time where every night I can get that 8, 9 hours sleep and feel refreshed and do my day. And now I'll average 6 or 7 hours of sleep, but yet I feel restful and it's nocturnal. Usually I'm up about 3 o'clock in the morning. I might walk into the kitchen and look out the window because that's on the front of the house, go back in the bed, go right back to sleep. And we've talked about this before, getting the proper amount of sleep. And I think 8, maybe 7 is a good, probably 8 or more. And if I get 7, I'm usually good. Sometimes it's less. So with that, I think it depends on the individual. Um, my sleeping pattern has changed, but I'm getting less sleep. But I think I'm alert, and I've never been one to lay down in the daytime, take a nap. I've never taken a nap. Taking a nap in the afternoon, it makes me sick. I don't feel well. Taking that afternoon nap actually makes me a little nauseous. So I can get that 6 or 7 hours. Hasn't always been this way, but now that's my pattern. So for some of us, it's age. I don't know what it is, but for some of us, it's a little different.
Oh.
Mhm.
Darryl?
Yeah, don't give up. For years, I was 6 to 7 hour sleeper. In my 70s, and you can work with that. Resistance training, doesn't have to be a lot of weights if you're a woman. Um, 5 to 10 pounds, even at 2 pounds. The key is to get your heart rate up, get a little sweat. Do it in the afternoon. That'll help you sleep.
Mhm.
Some other things could be medication related. If you're magnesium deficient, uh, that could be interfering with your sleep. So if you need to take a magnesium supplement, anywhere from 2 to 400 milligrams, taking it before you go to bed, it's going to help your sleep and reduce your blood pressure. Um, Things like we've talked about melatonin,
Mhm.
5 milligram. That's a minor dose, but it can really help your sleep. So um, now I'm, just by making those tweaks, I'm a consistent 8 to 9 hour sleeper, and I feel refreshed when I wake up.
Okay, something to think about.
Janice, I'm just like you. I used to get sleep long, but now it's 6 to 7. And once in
Right.
a while, I wake up at 3 or 4 and I say, what's wrong? But then I
Right.
go back to sleep and I
Mhm.
don't know what it is, but
Yeah.
yeah.
I'll wake up, you're right, but you
And
do go back to sleep.
yeah. And it's
Yeah.
not to urinate either. It's just
No,
waking up.
waking up.
Yeah.
Yeah.
When you got worry will wake you up, and
Yeah.
a good counter for worry is meditation. Several ways to meditate. There's yoga practices for meditation. There's just sitting still in a dark room. Uh, but it's like making it a regular habit. If you're having worry problems, you need meditation.
Dr. Perez and then Pearl Lipscomb.
One of the things that we've been also talking about is watches, the Apple Watch and other kinds of, they also have rings, because the stages of sleep as we've discussed, are very important. And many of these devices, knowing that if we were dealing with equity, the people who have the most trouble should have access to those strategies and devices that help. That being said, um, when we know what stages of sleep we're missing, with meditation and with other strategies, we can go back to sleep and maybe catch up on those areas of deficiency. Like we now know that deep sleep occurs early in our sleeping. So, definitely more research is needed in this arena, and research from people who generally do not become part of the studies. So it's critical that we be involved in research. But just those tidbits to what we're talking about as it relates to sleep. Having a device that could tell you the stages of sleep following your wave patterns while you're sleeping would be invaluable.
Earl Lipscomb.
Yes, good morning, everyone. I was going to comment about getting up during the night to urinate. I have kidney disease, and my doctor had told me to drink a certain amount of water every day, which I do. And he had told, well, it was she had told me to drink the water throughout the day. Well, for the last, I would say maybe year and a half, I have been trying to drink it more earlier in the day so that I would not be getting up during the night. But I find out it hasn't made any difference. I still get up during the night. And I was just wondering whether it was from habit, since I had been doing it for maybe, say, the last 20 years. So I didn't know whether it was just from habit, me getting up during the night, or I don't know.
Are you on any medication at all?
Yes.
What medication are you on?
I only take a blood pressure pill, and Pravastatin. I don't remember what that's for, but I've been taking that for quite a while.
What's the name of the blood pressure medicine you're taking?
At a Atenolol, ATEN.
Okay, I tell her, okay. Yeah, because it's not a diuretic, so it wouldn't make you urinate. So it may well be that keeping hydrated and the price you pay for that may well be nocturia. And uh, that's something I think in order to keep your kidneys open, you got to have an adequate amount of hydration. Usually, you try to do that, as you mentioned, during the daytime and before you, and if you, as John had mentioned before, if you try to drink, not to drink after 6 p.m., that may make a difference. But uh, with kidney disease, you need to stay hydrated. That becomes very important. John Buchanan.
Yes, I suffer from uh, sleep disorder. So I have a CPAP, and it monitors my amount of sleep. It also monitors my breathing pattern. Um, and I didn't know that I snored. Um, several when I go on these trips, and I have a roommate. The roommate said, "Well, you snore," and so I have mild sleep apnea, and the CPAP helps with that. And if anybody has that snoring effect like I do, uh, what happens is that you stop breathing, and that's not a good thing. So and stopping breathing cuts the amount of oxygen that goes to your brain. So um, I recommend it highly to get a sleep study if your partner, your roommate says you snore. Thanks.
Thank you for sharing. There aren't any other comments, and I guess we can move to the articles. Any other comments? Uh, this I thought was a very appropriate article that talked about the Apple Watches and goes back to the fact that uh, there's no equity in having people who wear watches and people who don't wear watches. And it's pretty clear to me that the people who are or who have higher amounts of salaries are more likely to be wearing watches, and therefore they can uh, keep up with their heart rate and also make the diagnosis of arrhythmias. And the most common cause of death for heart patients is actually arrhythmia. And so uh, I think having equity among people able to have wearable technology on them is something that it's not mandatory, but it's something that probably after you reach 65 may be desirable. But smart watches are something that are optional, but I think uh, we're getting close to the point where it should be uh, important for all of us who want uh, to have uh, smart watches so that you can keep up with your heart rate and have a diagnosis of arrhythmia when it occurs, so you can be treated for it, since it is a common cause of death that could be uh, uh, dealt with if you had a smartwatch. So, and the fact that this study shows that the diagnosis of atrial fibrillation could be picked up more likely if you wore a smartwatch is a good reason why we should have it available for anybody who wants it, but we don't. And so it's food for thought in terms of our future. Darryl?
This is my Apple Watch. It picked up my AFib episodes. I got treatment, and then later I got a cardiac ablation, which fixed my AFib. So yes, I'm a believer in Apple Watches and their EGG app.
How expensive are they?
Um, I buy mine used off of eBay. So I buy mine for a couple of $100. You could spend 600 or 700 bucks on an Apple Watch, but I don't because I buy used.
Yeah, so so it can be prohibitive for somebody who doesn't have a upper echelon uh, job or salary. Yeah. So we're still at a point where it's not something that is equitably available. And I think it's gotten to the point now, it becomes almost as important, just like for a diabetic, you need to have continuous glucose monitoring. I think when you're over a certain age, maybe a smartwatch uh, should be more than optional. John Buchanan.
Yes, I had a question for Darryl. Are there other brands that have the smartwatch capabilities, or can you install those programs on other devices like smart uh, pads, iPads, and that sort of thing? Is that possible?
I don't know about iPad. I'm going to do a search on other watch brands that can detect AFib. So give me a minute, see what it says.
All right.
Okay, any other comments or questions? I think it's a very important article that points out the need for equity in this area, which is going to be hard to come by, but something that I think is important. Right? Okay, let's go to the next
Okay.
article if there are no additional comments.
Well, apparently quite a few brands. Fitbit, Alive Core, another Fitbit model. Um, there's a Cardia Mobile that you can. It's a smartphone app. Samsung Galaxy Watch. Seculife, another Samsung. Yeah, so I guess there's quite a few watches other than Apple watches that have an AFib detector.
And this next article is an interesting segue that talks about the standard of care in diabetes. These are the devices, and for diabetes, the state of the art is such that it is expected that you have continuous glucose monitoring for diabetics who are on insulin. Used to be a time when it was kind of optional, but now it's gotten to the point where it is expected, for the most part, that you have continuous glucose monitoring uh, rather than the finger sticks that used to be so common and prevalent. And now it's the expectation that if you're on insulin, that you have a continuous glucose monitor to address the possibility of the hypoglycemia that can cause you to black out, or the hyperglycemia, which can cause you to black out. So, so the state of the art now is that just about everybody who's a diabetic who's on insulin, that needs to have a continuous glucose monitor, and usually that means a device. And I think the state of the art is that just about everybody now, and that's what this article talks about, the fact that continuous glucose monitoring is the expectation, which means that you have some kind of a wearable device that evaluates your blood sugar on a continuous basis. So the same thing that we have for diabetes, we need that for cardiac care as well. Any comments? Because I think this is the state of the art in 2026 for diabetics, and the expectation that devices would be used. John Buchanan?
Yes. Is that little white thing that's on people's arms? Is that the glucose monitor?
It could be. I don't know.
And I was wondering how that works. Do uh, it's got to be an operation to put it in, right? And then you don't take it off when you take a bath or a shower or go swimming or scuba diving.
Lucy, do you want to answer that question? Dr. Perez? Disappeared.
You can go scuba diving with it on, and they even have special patches to reinforce it. Usually you can wear it for 2 weeks, and you put it on yourself. It's a prick, and it's usually in the upper part of your arm. And uh, it's been phenomenal for me. The other issue is that uh, insurance, and this is where insurance becomes an issue. Insurance pays for it with certain conditions as a pharmaceutical product. And then for other kinds of conditions, it's durable medical equipment. And I make that comparison because information is power. There are some diabetics who become hypoglycemic and they're not on insulin. And so, therefore, for them to have a device, which is the standard of care, they have to pay out of pocket. And I say that because out of pocket has gone up tremendously when it became something that the insurance companies would pay for. So therein is the politics of insurance companies and those who need who may not get. But it is, you know, now at this stage, you can get a glucose reading every minute, not only on your phone, but if you have a watch, you can find it on your watch as well. So the innovation is amazing.
And as you said, it's state of the art. So as this article points out, that if you're a diabetic, whether it's type 1 or type 2, the continuous glucose monitoring is the expectation. Any other comments on this? One of the commonest diseases of people of color is diabetes. So, okay, very important article to know about. Okay. And this article timely as well because what they're saying is that CMS, which pays for the Medicaid and Medicare, his expectation is they're going to speed up tech innovation and artificial intelligence, whether we like it or not. That's the expectation for 2026. And so this is taking place so that AI is with us and innovation with the wearable apparatuses that measure glucose and heart rate are the expectation of 2026, so that doctors need to be on board and patients need to be on board, that the technology has taken over, and it is the expectation that you will be part of the process. Any comments? Because I think this is very important to know and understand, and that your healthcare provider has to be able to fit you for these these advantages in technology, which are with us whether we like it or not. Any comments about this advance that is here to stay? John Buchanan.
Yes, I definitely concur the observation about the inequity with you know the different people who can afford this, and it's almost like it's going to be written in stone.
Yeah, yeah,
people
yeah.
who can afford it are going to get it, and everybody else is going to just die as a result of not having these advances able to apply to their lives. The thing about
Painful but true.
Aura, you know about Aura?
No.
Or yeah, it's if you look at, remember um the Terminator?
Yes.
Yeah, they were talking about AI taking over the whole world. you know. So
Right, right.
this this is a step where if we don't stand up and take a major stand, I'm talking about everybody. We're going to be left in the dust. I mean, there's not going to be anything left to hold up. There's not enough people to combat the technology because it's going to take over everything. Thanks.
So true. Lucy, you wanted to make a comment?
I just wanted to emphasize that point. That is so critical. And we have got to be in the mix. That's why this support group is so important. There are people who don't know that. And this kind of information is critical for how we move civilly, meaning how we interact, who we want to elect. The
How do,
person
how
who's
do,
how
how
did
do
I
we,
get there?
yeah, how do we get more people to be educated and empowered to understand what's happening to us?
By talking about it.
Yeah, but how do we get more people to participate? That's the question. It's easy for us to say, but we're on the inside. What about those people who are on the outside and need to be on the inside? Because what do they say? If you're not at the table, you're part of the
Yeah,
menu.
that's right. We
We
have to
we
talk it
don't
up.
control the news. We don't control the news. That's the problem.
But we may not control the news, but we each have a circle of influence. There are people who listen to what we say. They may not be the big crowd, but there are people who listen to Nana. There are people who listen to Lucy from off the block. And when people who are connected to us see the importance and passion in us on a subject, then they'd heed.
Well, we have 11 people now, so it's tough to make a difference with 11 people. So
But Dr. Callender, I can't accept that because you being a part of this program, you have revolutionized what we do in transplant medicine. You have brought people who would have died are living today because of you, one person. So I'm saying you don't what none of us knows. It's just that we need to be committed to the work. I see my sister Carol. I know she is committed to the work that she and her husband have done. Committed. And I look at her. Every
well,
time I get ready to pick up something that I should not be eating, I think about the transplant support group.
you think about Darryl, huh?
Yes. Process. I'm looking at labels. When I'm in a rush, I am. You don't know.
I know, but what the point I'm making is that Darryl has a program that he has, and so a lot of people get the message from different ways. But it does appear to me that we've got to get this message out to more people. That's the point I was making. That we have to get more people to be educated like we are, because it's important to us for our existence, as John Buchanan has stated, because he hasn't overstated the importance of it. Darryl.
Okay. I'm just looking at a search. I put a search question: how many black people attend church? And it says black church attendance shows high engagement, but with generational shifts. Roughly two-thirds of Black Americans attend services at least a few times yearly, with about a third weekly. So that's a lot more people than the 11 that we've got on this group session. Um, we know what the agenda is for Black churches, and what's not on the agenda is information that's on this group session. Don't need a lot of time, but we got a lot of our 11 folks, we probably got about 8 or 9 that are regularly involved in church services. You know, talk to your pastors, ask for 10, 15 minutes, a church service where you can share information. Uh, because, you know, it's not all about just being saved. Um, we had a lot of social information in the 60s for Martin Luther King. Not so much anymore. It's time for it again. We really need it.
Well spoken. Any other comments? This is becoming critical for us to make sure that other people are as informed as we are. And your recommendation, you know, it's one of the reasons why we have our newsletter that we have in our church, so that others would try to stay abreast. But it's an effort that can't talk enough about how important it is. And it's interesting that Darryl has done so much in terms of getting his message across with his program that he does every week, as well as what we're doing. So it just seems that the more the merrier. And how do we ensure that this message continues? Yeah, we're 50 years old, but uh, what's going to happen as we age out? How do we keep it going? Becomes the issue. Okay. There's no other comment. We'll go to the next article. And you know, it's interesting. The more that we share information, the more items we identify that are part of the problem. And this article is further takes on the story that we had last week about preservatives. That the preservatives in our food that are associated with a higher cancer and higher diabetes risk. And this article identifies once again for us the things they put in our food that actually increase the likelihood of type 2 diabetes and cancers, different cancers, particularly the breast and prostate cancer. And then, of course, the concern about Parkinson's disease, which is also related to what we're exposed to. And I think recognizing that much of what we interact with becomes part of why we have so much more cancer and we have shorter lifestyles in other countries. So keeping in mind that in many ways we are what we eat, we have to recognize that we have to be very careful with what we put into our mouths and our stomachs. We've talked about what the preservatives for the food. We talked about the plastics. We talked about uh, so many things that the air pollution, so many ways in which information is power to try to help us to adopt healthy lifestyles. But the more we learn, the more frightened we might become because there's so many ways in which we are being poisoned. Anyway, it's food for thought. Any comments about this article, which talks about the many ways in which the attempts to preserve and process foods results in a backfire that increases our diabetes and cancer rates? Any comments? Yes, John.
I have a thought about it. I mean, without preservatives, and I've seen this, and Darryl's pointed it out too. Without preservatives, like with the organic food, sometimes they don't last but for a second. I mean, if you're gonna buy organic, you better eat it. Take it home and eat it. Don't try to store it. It'll spoil. So I mean, it's a trade-off.
Yeah.
You have food that can last for a while, but it's killing you at the same time. It's kind of crazy. Sorry about that.
Yeah. Well, it's important to know what we're eating and Darryl, you had a comment you want to make about it?
Yeah, about John's comment about organic food, it doesn't last long. Yeah, so you have to change your routine. I go to the grocery a couple days a week. I mean, yeah, a couple days a week because I know I'm going to get 3 or 4 days max out of the organic stuff that I buy. So, the stuff of buying your groceries for a week or two at a time, that doesn't work for me because the food doesn't last.
Any other comments? Okay, what are we to do? What are we to do? As Darryl gave you a recommendation. That's one of the things. Okay, the next article is one that's kind of frightening. Is that fewer young adults are dying from the leading causes of cancer death, except colorectal cancer, which is one of the diseases where the leading cause of cancer deaths in people under 50 is colorectal cancer, a diagnosis that is preventable. But we talk about uh, doing cancer screenings for colon at the age of 45 when you have people who get this disease at 30. And so um, this lady here was 30 and she has stage 4 cancer, colon cancer. So why are we getting cancer at such younger ages? And what are we going to do about uh, preventable cancer disease that we aren't screening for at younger ages? And so this is the bad news is that the rise in colon cancer deaths went from being fifth to be the commonest cause of cancer deaths among people younger than 50, which is frightening. So your children and grandchildren and other who are younger than 50 uh, still should get colon screening uh, because colon cancer is rising where other cancers are decreasing. Darryl.
Yeah, colorectal cancer is increasing with the young because of high consumption of ultra processed foods, increased obesity rates, and sedentary lifestyles. I have a friend who's a OBGYN nurse, and she says that she's been doing this nursing for like the last 30 years, and she says that mothers are typically obese now. Whereas you look at childbearing age women in the past, usually weren't obese, but now they are. And when I look at kids in south side of Chicago, if you're a gang, if you're unless you're in a gang, you stay indoors after school. You don't participate in sports. It's too dangerous to go out to go outside. So their sedentary lifestyle after school, they watch TV and eat snacks and get fatter and fatter.
Wow.
But it's kind of a sad situation. Instead of impacting our obesity epidemic with ways of healthy eating, we try to put a band-aid over the problem by weight loss drugs. It's kind of a sad situation.
Thank you for sharing. Any other comments?
So true. It's like we know the information and we're going in the wrong direction.
Yeah.
And I know for one other thing that I just thought about with a strategy I haven't heard of, but it's in the arena of equity. If if getting fresh fruits and vegetables multiple times is important for people and important for all of the risk factors and the diseases that we've been talking about, why aren't we moving to making delivery of fresh fruits and vegetables available to people, whether that's a discount on Grubhub from the supermarket or whatever. But it's not one of the things that we can consider to be a good strategy, yet we know that it's very important. Likewise, after school programs, interaction for our young, none of those things do we invest in, yet we know that we pay the price for on the other end. So like we talked about, we need to be the voice, the advocacy for these things that we know make a difference.
Thank you for sharing, Lucy. Any other comments?
It seems to me that a very high risk group now appears to be the very people we thought were invincible, the younger people.
Yeah.
And among those of us who are more informed or who have had histories of cancer in our families, etc., we are more aware. So we're picking the right foods. We're going to organic markets and all of that. The young people are the ones who are eating a lot of junk food all the time. So, how do we increase the amount of information that they get? Should there be a warning on each packet of chips? you know, or screening? Can there be some kind of screening earlier um, in young people's lives? Is there a drive, Dr. Callender, among say GI docs or just the scientific community to target the young people to pick out those most highly at risk for GI cancers? Do you know?
Well, I think this information has just become available. That the fact that colon cancer under 50 is the number one cause of cancer deaths. And so a strategy to overcome it has not been put together yet. And so we need to become part of that strategy. Your point
And
is well taken.
it's not always obesity either. We think of people who have died with colorectal cancer, like the actor Chadwick Boseman. Never in his life was he obese. So,
No.
one of the things that are pointing out, how would we identify someone at risk,
Well,
family history?
family history. But I think that we have not, for example, one of the ways to and change things, would make the screening for cancer come at a much younger age, which we have not
Yeah,
done. So we have to take the facts that we now have and change our ways of doing things. And
absolutely.
so we have to share this information because information is power. And and if we're slow to make the changes, like the National Medical Association and other groups have to be at the forefront to insist that the kind of changes that Dr. Perez is talking about become our strategic plan for the future.
Yes. Thank you.
Okay, if there aren't any other comments, oh, Darryl.
Okay, well, if you're looking for federal and state government to do something about this or for us, it ain't gonna happen. So you gotta you gotta look to what you can control. And like I say, most of the people on this group session are involved in church. And so it's a matter of priorities, where your money goes for your tithes and offerings. Some churches have soup kitchens that operates on Saturday afternoons, and that's great, except for people got to eat 7 days a week. So, it's kind of like a little, but not a lot. But there's enough church membership, and we're supposed to be a Christian nation, which means that there's enough people involved in church that we shouldn't have a homeless problem in the United States, because the Great Commission said, house the homeless, feed the poor, feed the hungry. So there's a whole lot, there's a greater impact that churches can have on the community, and that impact should show up where we need it instead of with pastors' Mercedes and nice houses.
Thank you for sharing. Excellent point. Excellent point. This article just emphasizes the point once again. But I think that the National Medical Association could be involved in this, and we'll have to talk to Dr. Mitchell and others to let them take this data and develop a strategy for us to do this. But your point is well taken. If we don't do it for ourselves, it's not going to be done. And the church is because uh, that's the role of the church, should be the role of the church. So,
Dr. Callender, um, the church is really us. So how many people on this panel? We only have 10 because somebody has 2. How many each of us are able to take somebody into our personal own homes? How many of us personally will go out to look for a family to feed or one individual? It starts first within yourself. And if you join a church, then you're part of the church. But it all starts with us. Everybody wants to blame the church, and they forgot they are the church. So we can do all this rhetoric, but until we start with ourselves, and personally, like myself, you know, can you take some? Well, are you willing to say that you someone you know that's homeless? Are you willing to say, come in my house, even if you have to sleep in the living room? We were able to take. It was a time that people just did that, but no longer. We're very selfish. We don't believe in even we blame one group of people for letting everybody several generations live in one home, but that was a time was the norm. Now even including the children, everybody got to have their own place, their own space. So, and I can personally say I've done it a few times. of taking others in that you know, but it is a hard thing to do.
Thank you so much for sharing. Thank you so much. Well
And
spoken.
Carol and
Darryl.
John have taken in so many people they've lost count. It's somewhere around 30 people that they've taken in, and it's not like taking in for a weekend. Some of the people have lived with Carol and John for years.
Yeah. Well, uh, Carol spoke well. It's us. So okay. Any other comments? If not, we'll go to the next article. And this is an article that I just wanted to remind us that us old folks who are older than 65, that you need to get the enhanced flu vaccines. And that if you get the regular vaccine, that's not good enough. When you're 65, your immune system is weakening, and you need to get the enhanced vaccine for flu that is a double dose. And if they don't give you the double dose, you need to ask for it. And if you ask for it, make sure that you get it because it does make a difference. Uh, and of course, if you immunosuppressed, it becomes even harder because if you're over 65 and you're immunosuppressed, that means you need even more. But it's at least important that you get a double dose if you're over 65 because your immune system has weakened. John Buchanan.
Yes, once again, what is adjuvanted vaccines?
What is what?
Adjuvanted is highlighted on the screen there.
Oh,
High
that's
dose vaccine.
yeah, yeah, yeah. Those are enhanced. Those are uh, more potent, high dose vaccines. Uh, in contradistinction to those people who don't have double dosed vaccines. They just have the regular dose for people who are under 65. And this was just to remind everyone that when you're over 65, your immune system's weakened and you need to have the enhanced uh, vaccine dose in order to protect you. And I read I guess we share an article that the success rate of the vaccine is about 40%. So that means that 60% of the time it's not going to help you, but 40% of the time it will, and it's likely to keep you from being hospitalized and dying. But you wish it would be greater than 50%, but it isn't. Any other comments about the importance of being vaccinated and also, especially the flu vaccine, and then if you're over 65 to get the enhanced dose, double dose. Okay, we'll go to the next article. This is an article that points out that a number of groups are suing to disband the Advisory Committee on Immunization Practices. We all know that they have gone a long way towards decreasing the number of people who get vaccinated, and this is an attempt to stop Kennedy's movements. And this article indicates that the first hearing on this is going to be in February 13th, I think is the time. And whether It's my guess that all they'll do is talk about it. I don't think that by the time the courts finish with it, uh, hopefully the Republican administration will be out of it. But uh, but I don't look for a timely disbanding of the advisory committee on immunization practices. Uh, by the time the court system finishes with it, I think it'll be too late. But we shall see. Any comments? We all know what the advisory committee has done in terms of the flu and the COVID and measles and other vaccines. So that's no mystery. The question is, will the courts overturn any of this? And I personally doubt it. Any comments on what the CDC has done and the likelihood of the courts overcoming their changes that they've made? Any comments and any expectations or thoughts about the fact that they're suing? Is that a lost cause, worth the endeavor? What are your thoughts?
Dr. Callender, I'm sure everyone else shares the feeling of shock that we've experienced in the last less than a year over how easy this process has been for people who are against the standard and accepted ways of protecting the population of this country from diseases and pandemics and all of that. Well established scientific things. And how has it been so easy for a number of people to just turn everything upside down
You got a
and
president.
increase our risk for disease? And
You got
even
a
the
new president.
president, I feel, has too much power to do that, to allow these things. Where are all the safety, uh, what do you call them? The guards.
Yeah,
It's shocking to
the
me.
the guards are supposed to be the Congress of the United States and
There
the
you go.
Supreme Court. They're supposed to be. That's the protection. And your question is an excellent one. Dr. Perez?
They also put out a blueprint, Project 2025, with exactly what they were going to do.
Yes,
They said how they were going to attack,
absolutely.
and I guess we didn't believe that they were going to attack at that rate. And I can't even say that because many of the things, I went to things when we talked about how crazy what they put down, how they were going to attack our
Yes,
health care.
yes,
And they went, like a logarithm. They followed it.
yes. They are following it.
They are following it.
Right.
And I haven't heard of our Project 2026. Where's our project? Where's our plan?
Well,
Where
your plan has to begin with getting the Congress changed. You got to have because as long as you have this Republican Congress, nothing's going to change.
Healthcare is
Darryl?
one thing. Excuse me. I was shocked when I woke up this morning to the news that the president and his people went to, I guess it was Georgia, to pull all the ballots and the votes from more than 4 years ago when he said he was cheated out of the vote, and I'm going to find out who did it and I'm going to prosecute him. What's up with that? I don't get it. Does
we've been
he?
We've been talking about dementia all morning.
Yeah, it's crazy. I was shocked. I
It's very
mean,
sick.
you wake up in the morning and you shake your head and say, "Is this for real?" What can you do? I
Yeah,
mean,
we voted all that stuff in,
yeah.
you know,
Well, I didn't vote.
by a huge majority, by the way.
Yeah, yeah. Not my vote.
Darryl?
What Trump said in the 2024 campaign, he said, vote for me and you won't have to worry about voting again. So, you talk about the 2026 midterm elections. That's if they hold the elections. There's all kind of reasons to suspend elections, saying that there's insurrections going on and it's martial law and have to suspend the elections. But one of the things that Project 2025 figured out is that if the courts are a guardrail, the courts don't have an army. All they got is a marshal's office, and that's to pick people up and take them to jail. Uh, but the courts can rule one way. You can still do against what the court ruled without any repercussions. The courts ruled that you can't pepper spray peaceful protesters, and after the courts ruled that, Border Patrol and ICE are still pepper spraying peaceful protesters. Um, so, and then you have to have a Justice Department. You have to have an Attorney General that will enforce the laws and uphold what the courts say. You don't have that. You've got Justice Department that's doing the wishes of the president. So guardrails
Right.
are off.
Yep. Yep. That's the tragic aspect of what Gina was talking about. Yeah, guardrails are absent. Okay, let's go to the next article unless there's additional comment. Yeah, I've included this because I thought it was so important to point out that the National Medical Association is doing the best it can to counter most of the things that Kennedy is doing, but uh, uh, the efforts seem to be in vain, but they are doing it nonetheless. And so this is an article in which the National Medical Association has come out and strongly opposed uh, action, which is just one of the many things uh, that needs to be done, as Darryl just spoke. Uh, we have been unsuccessful at challenging any of the efforts that the Republican administration has made to uh, change the democratic process. Period. So, are they going to listen to the NMA? Who's to say? Are they right in what they're saying? Absolutely. Uh, but one of the things that has been clear is that what we've noticed over the last couple of years is that how do you differentiate between the truth and the lie? Uh, and how do you keep the lie from becoming the truth and the truth from becoming the lie? And this is kind of what we're seeing in practice. So uh, this is a stand, though, that is noble and is one that I think is appropriate. But what will happen as a consequence is the real question. Any ideas or thoughts? As the NMA continues to voice its opposition to just about everything that Kennedy is doing. It seems as though no one is listening. But anyway, thought it was important to share that people are opposing. But Dr. Perez?
I think it's important for us to recognize the value that the NMA has in speaking for us, in all the ways, and how important it is moving forward, that it is a trusted voice. Because I think that, as we can see, the economic benefits for certain decisions that are made, and the advocacy for those who need equity in healthcare services, having the National Medical Association speak for us and be supported by us, and us repeating those things that we hear from the association is critical. And
Well,
the partnership, go ahead, the partnership between the National Medical Association, as being a resource for the church, I think is also very critical.
well, one of the things that I have to point out is that whenever people speak out, this administration finds a way to punish them. So the question will be, what is going to be the retaliation, and how do we protect the NMA as they begin their retaliative efforts?
Touche.
Because I don't know anything that the Trump administration has not tried to silence, and I expect they would try to do the same thing with the NMA.
But this isn't our first rodeo.
I think that's an excellent point. This is not new for us, so go ahead, come with your best shot. We're ready.
Absolutely. Put it to the people.
Okay. Well, anyway, I thought I'd share that. I know it's 10:30, so it's time for us to end this meeting. So, but we've talked about a number of interesting areas, and talked about things that we needed to be doing that get the message out, so that changes will be made. And I think this is a group that has challenges, but it's not. This is not our first rodeo either. So let's go for it with all the gusto we have.